My name is Dr. Tlaleng, and I'm a service provider. And in terms of HIV and how it's part of my story, it's mainly because of the clients that I see and where my passion lies in sexual health. HIV is a manageable disease. It's a disease like diabetes, like high blood pressure. Everybody needs to eat well. Everybody needs to exercise. Alcohol, smoking, all of the bad things that impact our health. So HIV, honestly, for me as a service provider, it's just another disease. Have a positive attitude because that impacts. We know you can see someone who's, harboring, a lot of fear, a lot of anger sometimes. Sometimes you're uncertain. And I think when it comes to HIV, it needs you to believe that you can be well. Because I can give you the prescriptions, I can give you the medicines, but if you do not believe that that will work, we're going to see that. Once you get the diagnosis, find out all the information that you can. If you don't know anything about HIV, it's okay. Ask the questions. If you don't understand anything about treatment, ask, and just keep asking and asking and asking. Because even myself as a doctor, there's new things about HIV that I'm learning on a daily basis. Research comes out, new treatment guidelines come out. So even I must keep up with the latest and the most relevant guidelines of treatment. So I think my message for the people listening is that arm yourself with knowledge. Sex and HIV, it's exciting. It's all about understanding your risk. If you are, for example, a young woman who's HIV positive on your treatment, you need to understand what your risk as a woman is versus your male partner, for example. You need to understand why it's important that you continue to use a condom. Even if your partner is HIV positive, using a condom still remains the number one protection for everybody. Because if you are HIV positive, your partner is HIV positive, your strains may not be the same. So the type of HIV may differ. So you don't want to be cross-infecting each other with each other's different strains of HIV. Another important thing is, yes, you are feeling well. Yes, your bloods are wonderful. But remember that you are both on treatment, for example. You don't want to be crossing that HIV that has been exposed to treatment to one another. If one of you perhaps is still not on treatment, you also don't want to do that, because if, for example, you're having unprotected sex with a person who's not on treatment, by the time they start treatment, it may not work because their HIV virus has now been exposed in very small amounts to the antiretroviral treatment from the one partner. And now it means your HIV then mutates and forms a harder shield for the drugs to then work, which used to be a big problem in the beginning, because even as doctors, we didn't understand that and we were not articulating it properly to our patients. So we need to use condoms all the time. And now the next thing is, I'm having sex, maybe a person is a man having sex with other men. What then? Also understand the risk. Understand the risks that come with anal sex, for example. So if you're having anal sex, you need to prepare. You need to know that you need more lubricant than you would, for example, if you're having vaginal sex. So there's a lot of talk that needs to happen as well with your doctor, depending on the type of sex that you are having. Some people want to have children, and it is their right to have a child. Reproductive justice, for me, is another big area where I work in terms of, people's choices and rights to have children or to not have children. Some people don't want children, and we have to support them in those decisions that they make. If you are HIV positive, take your medicines properly. Make sure that you know your blood levels, your viral load, and your CD4 counts. When you want a child, come back and speak to your doctor, because there's a lot of things that we can do to help minimize the risk of passing the HIV to your child, because that's the number one priority. At every stage of your life, check in with your doctor or your health worker or your provider. There is still help, and there's people like myself who are willing to help.